offer just enough of that technology connection to families that our teams can get the data they need to then respond to changes in patient status. We have a theme around medically complex discharges, but it started with our infant single ventricle home monitoring program in cardiology. These are historically babies who have conditions like hypoplastic left heart syndrome. We know that they're at the highest risk for morbidity and mortality in what's called the interstage period between typically their first and their second surgery. And we send them home with medical grade pulse oximeter, medical grade digital scale with a smart stethoscope so that we can remotely auscultate their stent murmur. And what we found is that this daily check-in for this population has dramatically reduced the interstage mortality rate for single ventricle heart disease. Moreover, when we added these digital stethoscopes, we've actually now intercepted 6 to 8 cases of critical stent stenosis. We've been very fortunate to find such great outcomes in that program. In the same vein, we've also seen success with our neonatology catch program. When we send home medically complex former preemie infants from our NICU who go home with NG tube and supplemental oxygen and a complex medication regimen, that things would sort of predictably fall apart at home. Not through any fault of the parents, not through any fault of the providers. It's complicated to go from an ICU setting where you've got one-on-one nursing to a home setting where suddenly you are the care provider for that patient and all their complex medical needs. And where we check in daily, we're measuring the baby's weight through a digital scale. We can intercept if the baby's not growing correctly. And it's a 30-day bundle that we literally prescribe to these patients when they go home. And that intervention for NICU catch has now been demonstrated to reduce readmissions by 45% for that population, which is amazing.